Moving on to the first component of the neurological examination, and that is your focused general exam, and it's important to set the scene. The first thing we like to know is the patient's consciousness and also the level of cooperation. That's quite important because the neuro exam requires a lot of cooperation from a patient following instructions at all times. So if a patient is poorly cooperative, we know that we're not going to be able to get much out of them. So in an exam situation, you're probably going to have a cooperative patient, but it's important just to mention this here. We can also comment on anything that might be attached to the patient. Do they have any feeding tubes that might suggest difficulty swallowing? Are they catheterized? Which could be just for convenience sake, but it also could be for things like incontinence. So it's important to mention anything that's attached to the patient. We can look at the general things that we taught for all patients, like that acronym JACOLD: jaundice, anemia, cyanosis, clubbing, edema, lymphadenopathy, and dehydration status, and that's universal for all patients. Specifically for neuro cases, I like to mention as well, though, whether they have any features of a DVT, and these are for patients who are bedbound, who have lower limb weakness. So we look at their calves and we look for any pitting edema, erythema, or pain, and that might also be extending up the rest of their leg as well. We also like to look for cutaneous lesions, whether these are from the primary neurocutaneous syndromes like tuberous sclerosis or neurofibromatosis, or also a lot of our conditions in our context might be viral in nature. So we're looking for viral exanthems or features of connective tissue disease or like skin lesions in dermatomyositis. So just looking at the skin status is important. Pulses are very important, especially for stroke patients. I was taught that in strokes patients, if you miss atrial fibrillation, that's an automatic fail. So it's very important to comment on the rhythm of the pulse, but also to look for the carotid pulse, to look for any reduced volume on the side that you think is causing the stroke, which might be the etiology of the actual stroke. So this covers the important parts of the focused general examination for the neuro assessment. See where you are taught whether you need to mention other things, but in our setting, we don't expect you to mention the cardiac findings of like splinter hemorrhages, etc. But I guess if you do see it, you definitely can mention it, but don't waste your time mentioning them as negative findings. After covering all of this here, now we actually move on to the proper neurological assessment, which we're going to cover next.